moderator, Minerva.
Thank you so much, Sam. Welcome everyone to the Hunger Free Communities Respond to COVID Hunger panel. I'm so happy to be able to bring you this panel of our partners in communities throughout the country who have been working really hard to respond to the hunger crisis during COVID. They were doing this work before COVID, and we'll hear about what they've done since. And so I am very happy to quickly introduce our panelists. We have with us Faye Mack, Advocacy and Education Director from Hunger Free Vermont, Liz Accles, Executive Director of Community Food Advocates, Heather Bruskin, Executive Director of Montgomery County Food Council, Amanda Schultz Brochu, VP and Chief Programs Officer of San Diego Hunger Coalition, and Kate Howe, Managing Director of INDY Hunger Network. Welcome to all of you, and thank you for your partnership every day, as well as for being on this panel. So we're just gonna jump right in and ask each of you to introduce yourselves a little bit more and also introduce your organization. Let us know where you're located and your organization's role in the community. And why don't we go in the order that I just announced you in and start with Faye.
Sure, thanks Minerva. Thank you. Hi everybody, it's great to have you all today. As Minerva said, my name is Faye Mack. I'm the Advocacy and Education Director at Hunger Free Vermont. So I'm one of our two co-program directors. And Hunger Free Vermont is a statewide anti-hunger advocacy and education organization. We're a 501c3, has been around for about 26 years. And we are the state of Vermont's largest or most involved anti-hunger organization. We do our work in a few different ways. So we do advocacy both at the state and the federal level. So just seeing that comment, that looks like we're okay. So we do advocacy at the state and the federal level on federal nutrition programs, economic security issues like minimum wage and paid family leave, and other issues that we know help address the bottom root causes of issues like hunger and poverty. We also do technical assistance, training, and outreach for all the different federal nutrition programs. So we train social workers on SNAP application assistance, run statewide outreach for SNAP, work directly with schools, after school and summer meal providers, and other folks like that. And then we do a lot of community engagement because we know that we can't end hunger without the political and social will to do so. So one of our programs that we run, we manage 10 different hunger councils, which cover our state. They're a group of about 1,000 community members around the state who come together, used to be quarterly, very different now during COVID, to address hunger at the community level. I'll leave it there.
Thank you, Faye. Why don't we turn to you, Liz?
Hi, thank you, Minerva. My name is Liz Accles. I'm the Executive Director of Community Food Advocates in New York City. And we are a New York City-based organization. We do some state work, but primarily focused in the city. We are a policy advocacy organization. And the way we think about our work is we work on big impact public policy change and do that through solid policy analysis, budget analysis. And our method of doing it is by bringing folks together through strategic coalition building and organizing. So our two primary areas of work is we do a lot of focus. We spearhead a coalition called the Lunch for Learning campaign. And through that campaign in 2017, we got universal free school lunch in New York City. And we continue to strive to make school food in New York City the best it can be and remove any barriers from students participating. And then we also spearhead a campaign along with other partners called the Good Food Purchasing Policy Campaign. And there are other good food purchasing policy initiatives throughout the country, but that's using the procurement power of municipal governments for the betterment of the local and regional food economies.
Thank you, Liz. Heather, let's turn to you.
Wonderful. Thanks so much for the opportunity to be here today. It's such an honor to be part of this important conversation. I'm Heather Bruskin. I'm the Executive Director of the Montgomery County, Maryland Food Council. So we're an independent 501c3, and we have just a small staff of 7, but we lead over 400 community partners and organizations in food systems work in our county. For some context, Montgomery County is just outside of Washington, D.C. We have a population of 1.1 million, so we're a pretty populous county and one of the most identified as one of the wealthiest counties on average in the country, but we have tremendous income inequities and over, at this point, 100,000 residents are estimated to be food insecure. And that's driven in part by our high cost of living here. So a family of 4 is expected to be self-sufficient to have over $91,000 a year in income, which is more than double what that same family of 4 could earn to be eligible for programs like SNAP and WIC. So we have our 25 council members. They're volunteers who lead our 4 working groups in the areas of food access, food economy, environmental impact, and food education. And so we regularly convene our council members outside of those silos to ensure that our programmatic and advocacy work is as collaborative, streamlined, and systems focused as possible. And so we also bring together partners in our community weekly for our community food security gatherings, bringing together our many different partners across the food system. And each of our working groups is open to the public and meets monthly. And so we bring together government leaders and agencies, nonprofit organizations, businesses, and residents around these food system issues. And so our primary strategies are increasing the capacity of local programs, businesses, and organizations, growing and strengthening networks and partnerships, leading advocacy and driving policy and process change at the local, county, state, and federal level. So some of it's right at the town level, and some of it is working with partners across the country. We build knowledge and awareness of issues and resources. We research and communicate opportunities and challenges, and then finally serve to foster food system leadership locally, regionally, and nationally. So thanks again.
Thank you so much, Heather. Amanda, why don't we turn to you?
Hi, good afternoon, everyone. I'm just looking, I'm coming to everybody from San Diego, California. And so we're just heading into afternoon over here, but so grateful to be able to join everyone. So I'm the Chief Program Officer with the San Diego Hunger Coalition, and want to acknowledge that I believe our President and CEO, Anahid Braki, is also in this session and is available to answer additional questions in the chat or connect with people that are interested in learning more about the work that we're doing and her vision for the organization. But just to provide a little bit of context, the Hunger Coalition's mission is to lead coordinated action to end hunger across San Diego County. And we do that through research, education, and advocacy. We're really working to ensure that all San Diegans facing hunger have immediate, equitable, and dignified access to food assistance. And to provide a little bit of context around San Diego County, where we're operating, San Diego has a population of about 3.3 million residents, and we estimate that just under a third, or around 1 million, San Diego County residents are facing or at extremely high risk of food insecurity. And that's really related similarly to what Heather was sharing of high cost of living and some really significant income disparities and socioeconomic disparities in our region. So when we're thinking about that, we're covering an area of about 4,500 square miles, and we're roughly about the size of the state of Connecticut out here. So we're a local hunger-free community, but really taking on a large community and pulling together around 400 to 500 nonprofit organizations that are a part of the hunger relief sector and the wider community here in San Diego. And so really our goal is to make sure that hunger relief organizations have the tools they need to reach more people with better food, that hunger is no longer a barrier for individuals who are working to escape poverty, and that hundreds of millions of untapped federal dollars are coming to San Diego County to boost our local economy and end hunger. So we facilitate take a somewhat similar approach in convening groups of stakeholders. So we have 4 networks that we're convening. One is our CalFresh or SNAP task force. We have a Hunger Free Kids task force working on youth and school meals. I have Hunger Free Advocacy Network that works on state and federal advocacy, both administrative and legislative. And then we have what we're calling our Hunger Free San Diego Advisory Board. And so that's an advisory board of about 30 organizations that are really our kind of stakeholder leaders in the community that are helping us make decisions about how to take collective action. And so over the last 4 years, we've really been looking at assessing the landscape, creating some standardized knowledge around food insecurity, and then measuring the impact of our hunger relief sector and meeting that need. So excited to share a little more about that later.
Thank you, Amanda. Kate, over to you.
Thanks, Minerva. I'm Kate Howe. I'm the Managing Director of INDY Hunger Network, and I want to just show briefly a couple of slides to give you a better sense of INDY Hunger Network and what we do. So we, let me see if I can get that to show properly. We work in Indianapolis, so Marion County is our county, and the surrounding neighborhoods, surrounding counties. So we call that the greater Indianapolis area. And our mission is to create a system that ensures that anyone who is hungry can access the nutritious food that they need. We are made up of nonprofit organizations, corporate partners, and government agencies, both state and local, all focused on working together to improve the hunger relief system for our community. And we are a convener, as the other organizations have mentioned. We do a lot of convening, but we also do what we consider gap filling projects. So anything that benefits the member organizations and the overall hunger relief system that wouldn't really fall under the mission of those partners. So in the top right corner, you can see our annual food pantry conference, which unfortunately didn't happen this year because of COVID. But we try to bring together food pantries to learn from each other and from experts. We've created a manual of best practices to help food pantries improve their operations and the way that they interact with the people they serve. We also provide grants to them to improve capacity and the nutrition of the food that they distribute. Our food drop program is a program to glean semi-loads of produce that are rejected at their destination for one reason or another, but are still perfectly good, high quality food that can go into the hunger relief system. Just a few minutes ago, I finished talking about our Community Compass app in another session. We have a new smartphone app and texting service that connects people to hunger, to food resources in their community, including federal programs and food pantries and other charitable programs. We teach Cooking Matters classes across the city in multiple locations, and those are currently virtual. And then down below, you see a WIC ad. We've collaborated with our local Marion County WIC program to help market WIC and help women understand their eligibility for that program and get enrolled. And then down in the bottom left, you see a pie chart, and I know you can't read what it says, but I just wanted to throw in there that we do a lot of data collection and research about hunger in our community to help our partners do a better job of setting goals and figuring out if we're reaching that target.
Thank you so much, Kate. Kate, we're going to stay with you as we go to the next set of questions. How has your community been affected by the pandemic, and what has your organization done in response? And we'll ask all of our panelists to answer. I'll just go in reverse order than we just did. So Kate, we'll stay with you for the first answer.
Sure. So the first thing that we found is that hunger, of course, as everybody's finding, has increased in our community. Based on looking at census data and our own data from prior to the pandemic, before COVID hit, our food insecurity rate in the city was 20%. 1 out of every 5 people in our city experiencing food insecurity, and that's gone up to 28%. that was measured in June. So a really rapid increase in the number of people that are needing food assistance. We also happened to measure, we do our, every 3 years, we do a big study of hunger in Indianapolis. And we did that study in February, just because that was our, it was time to do it again. We had planned it for a long time for February 2020. And then by March, we realized that those numbers were no longer accurate. So we measure the meal gap and the number of people missing meals every time we do that study. So we measured the meal gap at 380,000 extra meals needed in February to make sure everyone had access to all the food they needed. And by June, that number had doubled to 740,000 meals. So we also were able to show that our partners who provide food doubled their output. So they doubled their output, but the meal gap still doubled. And so the federal assistance and the charitable response were critically important, but still not enough. And then our study also found, as probably most of you are seeing too, a disproportionate impact on the African American community with a 50% higher rate of food insecurity among African American members of our community than in the general public. So that's what happened. And then what we did to respond was several things. As I mentioned, we ran that study in February. We got funding from a local funder, the Indiana Minority Health Coalition, to run it again in June. And so we were able to document the impact. We also started convening, that's what hunger-free communities do so well, is we convene partners starting in March for weekly phone calls. Actually, in the first month or so, it was 3 times a week that we were all meeting by phone. So that's the INDY Hunger Network partners here in Indianapolis, but also our state agencies. FEMA joined phone calls, the city of Indianapolis, the Food Bank Association across the state, all of the Feeding America food banks. We get on the phone still every week to talk to each other about what's happening in terms of PEBT, CFAP, all these federal programs that have pumped food into the system. Where's it going? What are we lacking? How do we get access to non-perishable goods? How do we get toiletries for the people we are trying to help? All the troubleshooting that we're doing individually, we're trying to do it collectively by talking to each other regularly. We also, I mentioned our Community Compass app, which we rolled out in February as well, not knowing that March would bring a pandemic. And we realized that the need for that, there are a lot of people that lost jobs and had never needed food assistance before. And so being able to market Community Compass to them so they knew that they had a tool to find food and see if they were eligible for federal nutrition programs. So we got some money from our local United Way to increase the marketing of that and to add the marketing for the Spanish language. We already had the money for the Spanish language version of Community Compass from another source, but we didn't have money to market it in Spanish. So we put a lot of effort into trying to reach more people and add new features to Community Compass. And then the last thing we've done is we've worked collaboratively with our partners to create a home delivery program. We were hearing from a lot of people that they were senior citizens or they were immune compromised in some way. They had no transportation. They're home with their kids who, are e-learning, and they couldn't get to a food pantry. And we worked quickly with our Feeding America Food Bank and another local nonprofit called Second Helpings, which provides hot meals. And INDY Hunger Network started taking the phone calls. We became a call center for home delivery and sort of the data hub. So we had 2 organizations providing food, and then a third nonprofit called 913 Sports, which usually does educational programs for kids. They weren't doing that because the schools weren't open, and so they used all of their vehicles to start delivering meals. And that program is still going, and we're working on how to institutionalize that so it's a permanent program, not just a COVID response.
Thank you, Kate. Wow, it's amazing. Same question to you, Amanda. How did the pandemic affect your community, and what did San Diego Hunger Coalition do in response?
Sure, yeah, thank you. I'm going to share just a couple of quick slides. Let's see. So I think, yeah, really similar, echoing a lot of what Kate shared. And I also just want to acknowledge that I think the Hunger Coalition has learned a lot through this group of hunger-free communities and through individual partners. And so we've really learned a lot from INDY Hunger, and particularly around how we're mapping the output of meals, which I'll share a little bit more about in a bit, but just want to thank this group, amazing group of leaders and for coming together. And so when COVID hit, we really, our immediate response was around leveraging the relationships and infrastructure that we had in place through the Hunger Free San Diego Advisory Board and the various networks that we're facilitating. And so Hunger Coalition, the role that we played was really to strengthen further strengthen the communication channels and be sharing updates as the landscape was really quickly evolving, including our state and federal programs and various resources that were coming down, and making sure that our region was taking advantage of all those opportunities and was also aware of changing regulations so that they could continue to provide food assistance in ways that were safe and accessible for individuals during COVID. We scaled up a new website, got information out for people, for all of our partner networks, and then we created a lot of new content. So we, as we're thinking about new programs that were coming out, like Farmers to Family Food Boxes and PEBT, the Hunger Coalition worked with our network to create new content and get that content translated. For PEBT, we created content in 16 different languages to be able to get that information out to groups that might not otherwise have heard about these brand new programs. Similarly, we did a lot of work around resource coordination. So thinking about how we have a call center here in San Diego County, and that needed to be able to pivot to answer broader COVID calls. And they usually help people apply for SNAP, but we were able to reallocate resources and get some of our other nonprofit trained partners involved in answering those calls and making sure that people could still connect to benefits. Another major area that we worked on, or actually I should say under resource coordination, part of that I think is assessing the landscape and sharing that information with people who are in positions to be able to invest. And so we worked really closely with our partners to assess the landscape of food insecurity and what was needed by partners to continue to operate and provide services, and then share that information with philanthropic investors. So we were able to grant out, hundreds of thousands of dollars through these philanthropic investors to help nonprofits really be able to transition and pivot. So in this case, working with our schools to help them to be able to do drive-through meal service or bulk meals, working with our pantry partners and figuring out what their needs were to keep their pantries in operation and shift their distribution models. And then another big area that we've been working on more closely is community resident engagement. So recognizing that there are so many people who are newly eligible for benefits or just may not be certain about how these services are changing. And so working directly with community resident leaders to get information out there in ways that are accessible. And finally, policy, we've been working really hard on policy change through administrative and legislative advocacy to continue to streamline services and just make them easier to access. So that was kind of the immediate response that we took through working with all of our partner agencies. And I think the longer term response that we're moving towards in the last month or so is really a more concentrated focus on data gathering and assessment, and building on the efforts that we had been, that Anahid and the team had been putting into place with Hunger Free San Diego Advisory Board. We wanted to share and continuing to use that information to expand our networks and arming our community with more detailed information on where to go and how to get access to assistance. So I wanted to share just a couple of things that we're doing. Let's see. So, taking the information, we've been building kind of models to be able to estimate food insecurity across our county, but at a zip code level, so that we can support our network of partners to really be able to drill down and figure out where we need to invest more and target our resources. So here you can see maps of, we looked prior to COVID, kind of what might have been the peak, at least of the first wave of COVID, and then closer to where we're at now. And then the other thing that we've started doing, these are definitely drafts, but looking at where our food assistance resources are going. So working with our networks to collect data on where they're distributing food or where they're helping people apply for SNAP, where all of our WIC benefits are going, so that we can see, collectively across both federal and charitable food assistance programs, where these resources are and where there might be opportunity for further investment. So the other big piece that we've been doing is we're building a hunger-free navigator program. So building out those networks, now that we've got the information, how do we engage community members in getting the word out? And we're building trainings for both nonprofits and community members. And really thinking about putting these pieces together, it's about, we see this as an opportunity. There's so many people that want to get involved, so many people that want to help connect their neighbors, their friends, or themselves to food assistance resources. And so as we're pulling this data together and people, we're hopeful that this is going to create a really strong base for us all to be able to help each other and navigate what can still be really complex food assistance programs. And long term, we want to build an army of people that can help us, so that we can shift these food assistance programs to make them easier to navigate than ever before.
Thank you, Amanda. Wow, those zip code maps, I'm fascinated. I want to see them in very close detail. Hopefully you'll share those with us. Heather, over to you.
Excellent. Thank you. Well, it's so inspiring to see the amazing work that's happening in all corners of our country. So sharing a little bit more about what is happening here in Montgomery County, Maryland. So echoing the trends that my fellow panelists have shared, in Montgomery County, pre-COVID, we had an estimated 60,000 residents experiencing food insecurity. That has risen by close to 60%, estimated by Feeding America projection. So it's anticipated that we now have 100,000 people who are either experiencing or at significant risk for food insecurity. And similar to the health disparities reflected in our COVID numbers, our Black and Latino residents are 5 to 6 times more likely to be experiencing food insecurity. And these numbers in particular are really impacting our local children, with about a third of our students estimated to be experiencing food insecurity as well. And so one of the silver linings in this whole experience has seen the way that our community has really risen to the challenge of supporting as many residents as possible. And as I imagine other communities have experienced, we were very concerned at the beginning of the pandemic that there would be a significant decline in the number of organizations that were providing food assistance to residents, either with health and safety concerns or a loss of volunteers. We've in fact seen a 50% increase in the number of organizations that are doing food assistance work, and about 50% of those are faith communities, and really organizations that had perhaps been doing really small scale food distributions in the past have really expanded their efforts to close some of those gaps. And so the Food Council has been working with all these different organizations to connect their efforts to build communities of practice amongst all of these organizations, regularly convening them to share resources beyond food that are available in our county, recognizing those residents who are seeking food support likely are in need of other resources as well. We're also regularly conducting trainings for all these providers on topics from SNAP eligibility, kind of SNAP 101, how to support residents with applications, all the way through to cultural competency, nutrition considerations with food distributions, and safety operating during COVID. The county has invested over $2.2 million in direct funding support to these nonprofit nonprofit organizations. And that includes $1.2 million in capacity building investments for cold storage, refrigerators, freezers, transportation structures, or transportation investments, so that the investments that we're making both to respond during COVID will really support our community well into the future as well. And so this here is just a map of our food assistance resource directory. It's a searchable online directory of all our providers in the county that can be searched by zip code. It's used by our county's food access call center. And we call all of those organizations every couple of weeks to confirm that their information is up to date, because I think we all know that things are changing quickly, and also helping providers recognize who's also operating in their community so that they can better align their operating hours and services. And so there was a food security task force that was formed by our county's Office of Emergency Management and Homeland Security in early April. And so the Food Council has been the county's nonprofit lead partner in running that task force, which has had really amazing accomplishments, but there's still a lot of work to be done, primarily funded through CARES Act that was received by the county. There was a strategy released in early May to connect more food to more people through a diverse sourcing strategy. And so we've outlined some of the strategies that we have been pursuing here, but just really quickly to outline, we've been making direct purchases from over 20 local caterers and restaurants, supporting these businesses, these small businesses locally owned, to keep their doors open, to keep their employees on their payroll, and also to connect nutritious, culturally diverse, a variety of meals, including 88,000 meals to local seniors, and overall 206,000 meals have been distributed by our food assistance provider partners as well. We've also, to try to respond to supply chain challenges, have been purchasing over $8.6 million worth of food from a variety of local businesses, wholesale producers, and other nonprofit partners to distribute amongst our food assistance providers so that they don't have to be going to Costco to make those purchases directly, but rather leverage the large wholesale buying power of our local government and save the administrative barriers that a lot of our providers experience in their work if they had to do the sourcing themselves. We're also sourcing from local farms, making grant investments in these farms to increase their local food production capacity for next season. Invested $200,000 in local grants to nonprofits to increase their community and residential gardening strategies to, again, hopefully build our resiliency for the years to come. Have been investing in both government and nonprofit capacity to expand SNAP outreach and enrollment support. We've seen a 50% increase in the number of residents participating in SNAP just over the past 6 months, which is a massive increase. And we also regularly conduct advocacy to ensure that those expanded resources are sustained and hopefully expanded into the future. Conducting a resident-facing survey to really better understand what's happening on the ground in terms of food access challenges, and have established a food access call center supporting over 4,000 residents with direct access to both benefits programs and available resources. And then just echoing the importance of data, that's been a real critical need of ours. And so we've implemented a dashboard that will collect data from all our food assistance providers receiving support from the task force on their weekly services to residents related to food, so that we can compile and again really identify where there might be gaps in resources available. And so I'm happy to talk more later, but looking forward to hear from everyone else as well.
Thank you so much, Heather. Liz, let's go to you. How has the pandemic impacted New York City, and what has Community Food Advocates done?
Well, New York City was one of the, on the East Coast, one of the first biggest impacted communities. And, basically, like everywhere else, took an already significantly large number of people who are food insecure and just increase that exponentially. So I think it's roughly there were 1.5 million people in New York City who were food insecure prior to the pandemic. And I think it's the estimates that it's going up to about 2 million people. So that's the bad news. The good news is that New York City has done quite an extraordinary response using New York City infrastructure. So I'll just talk about that and then talk about our role in that process. So basically, once the pandemic hit and the decision to close schools, you know, as with most places throughout the country, one of the big factors in whether to close schools or not was where kids would eat. And the city basically did this unprecedented response where they took the New York City public schools and at its peak had 500 community, you know, it's the biggest single food serving infrastructure, not only in the city, but nationally, right? So they took that infrastructure that's in every neighborhood, it's staff, there are kitchens, there are staff that know how to do this work, and turned that into the main feature of the city's emergency response. There are 1.1 million New York City public school students, and New York City's school food program on a normal school day serves 900,000 meals a day. So the capacity, you know, and infrastructure is, nothing can match that. So that was exactly what you'd hope the city would do from a public policy point of view. The other thing about that is they were not just serving children, children were a primary target, but the meal sites were and still are open to everyone. So basically everyone who wanted a meal could get 3 meals a day, 5 days a week, meeting school food standards, which exceed the federal level. And that was really pretty extraordinary. So that's one piece of it. The other piece was something that I think is a lesson about government possibility, and that they realized they needed to have a real home delivered meals program for the many thousands of people who are medically vulnerable, and some who couldn't get out, and others to go shopping or get food, and others who shouldn't go out because they were medically vulnerable to COVID. So from scratch, the mayor appointed a food czar, and she was head of the commissioner for the Department of Sanitation, and she's an operations maven. So they started this home delivered meals program that in 2 months was serving 600,000 meals per day. So, you know, at the peak of and basically they used out of work taxi and limousine commission workers and new technology that's like Uber and other ride sharing things, where they could match people, the drivers could get meals and deliver them to people, and they did a whole bunch of contracts. So, and people could sign up self-attested to get 3 meals a day for 3 days at a time for 2 people in their households if they were homebound and otherwise couldn't get out. So you know, that was innovation. That was, you know, not the kind of thing that people usually think of government responding so quickly and like just moving on a dime. So, and using the incredible resources. We're an advocacy organization. So our role in this is that we do a lot of policy advocacy work. We spearhead this coalition called Lunch for Learning. And we've been working together for the last 7 years now around school food issues. As I mentioned before, in 2017, we got universal free school lunch. But we have a very large New York City public school parent group within the coalition called the Lunch for Learning Parent Caucus. We work with the school-based unions, the cafeteria workers, the teachers union, the principals union, pediatricians, anti-hunger groups, kind of a whole range. So we have people all through the city. So we were working with what's called the Office of Food and Nutrition Services from Department of Education to both track what they were doing, see what was going on in different neighborhoods, troubleshoot different locations, and also look for thematic and systemic issues that we could then raise. And we happen to be very, very lucky to have someone who's heading up that agency that is super responsive. So anyway, I realize time is short. The other thing that we did was focused pretty heavily on pandemic EBT. We have pandemic EBT for all 1.1 million students because of universal free school lunch, and that's great. But the state had to get that up and running in a very short period of time. And so getting information out, getting out with our network, that's been a huge part of what we're doing. And so people would know what pandemic EBT is, that they'd spend it and they'd know what it was when it was coming in the mail.
Thank you. Thank you, Liz. Let's get to Faye. And wow, the time is flying. We definitely want to hear what Hunger Free Vermont has been up to. And then I do have 1 or 2 questions from the audience that hopefully we can get in. Faye?
Sure, and I can be brief. A lot of what folks have said is true in Vermont as well. But prior to the pandemic, there were about 1 in 10 Vermonters who were struggling with food insecurity. In March, it was about 1 in 3. And right now it's about, or as of June, which is our latest data that we have, it's about 1 in 4. So we improved a little bit due to our really rapid and holistic response that Vermont took to the pandemic. One other thing to point out about how our community was impacted, like in other areas and similarly to COVID itself, BIPOC community members are 2.7 times more likely to struggle with hunger in Vermont. Households with kids are about double as well. And folks without a college degree were nearly 6 times more likely to face hunger due to the pandemic. And so we've basically done all of the same work we always do, our technical assistance, our outreach, our trainings, our advocacy, but through a COVID lens and from home. So I will just kind of highlight a couple of the different areas that we've been working in. We have done a lot of work to support schools in the response as schools shut down in March. Since March, Vermont has had a statewide sort of approach to meals. Every single school has been providing universal free school breakfast and lunch since the start of the pandemic. We were able to continue that through summer meals programs, and then in the fall. And I just learned yesterday that Vermont was the only state in the country in April that saw an increase in meals served. We had a lot of schools that were delivering meals door to door by school bus in our rural areas. The rural areas actually saw the increase, and our more urban areas saw a decrease because families had to go to the school or to a pickup site to pick up meals. So that was a really interesting lesson to learn. We work to advocate to make sure that some of the state CARES Act money went to nutrition programs. So we had about $12 million go toward schools to help with the adjustments they needed to do, the increased cost of food and labor, packaging, all the rest. And our hunger councils, so since this is a group of folks who do a lot of coalition building, our 10 hunger councils went from meeting once a quarter in person to meeting weekly by phone. And most are meeting now sometime somewhere between weekly and monthly. But we have been working very closely to kind of be, those councils are center points for a lot of the kinds of organizing that a lot of the other panelists have been talking about, of coordinating between schools and older adult providers and community members and mutual aid groups and all the rest to support new programs that have been popping up and making sure folks are getting connected to programs. The one thing I would say is that we've had a really strong response. We expect things to get far, far worse in January as people come off of unemployment benefits. And also we've had a huge increase in charitable food through the Farmers to Family Food Box program and some other programs, and those are all ending. We haven't seen an increase in SNAP benefits, but we're launching a big advertising campaign, not using federal dollars because that's not legal, in January to try to get some folks to shift to kind of a longer term view about how to support their needs. So that's really brief what we've been doing.
Thank you, Faye. And I hate to say we're out of time, but we're out of time. And so let's keep the conversation going in the community chats. Thank you all for the incredible work that you're doing in your communities, that you will continue to do. And thank you to everyone who joined us at the session today.
Thank you, Minerva.